Welcome, everyone. We're so happy to have you joining us today as we're going to talk about UVM's Integrative Health and Wellness Coaching Certificate Program. We hope you're having a wonderful day. We're going to dive right in because we have a lot of great material to cover today. We're going to go over quick introductions, why Integrative Health and Wellness Coaching, and why this program has been started at UVM and is turning out to be incredibly successful. So we're really looking forward to hear about that. An overview of UVM's Integrative Health and Wellness Coaching Program. There will be plenty of time for your questions and resources and logistics as well to make sure that you get the links that you need if you are interested in learning more as well. My name is Nicole Willier-Fenton. I'm UVM's Content Marketing Manager in the Continuing and Distance Education Department. I have the good fortune of working with Susan Whitman in our Integrative Health and Wellness Coaching Program. She's a lecturer. She is a curriculum consultant, certification mentor for Duke Health Coaching Program, and co-founder of Richmond Community Kitchen. Susan, thank you so much for being with us again today to talk about integrative health and wellness. And we're super excited to have one of our recent graduates, Eileen Ash, joins us in our studio on UVM campus today. Eileen, thank you so much for being with us to share your experience. And Eileen, congratulations. You just passed the Health and Wellness Coaching National Board. So she is certified, she is official, and we're going to learn about her experience in preparation for that certification. And she's also a registered dietitian and nutritionist. So looking forward to hearing about her work as well. So as I put in the chat box, just wanted to make sure that everybody has the logistics. Please ask questions throughout the presentation. I'll do my best to pause Susan and Eileen to make sure that you're going to get answers to those questions. Kristen just jumped off. Her camera was on there for a second. She's also in the chat box. She will be answering questions for us. She's on the enrollment side and advising side. So she would be working closely with you, setting up your curriculum and your course plan. So Kristen, thank you so much for being with us and answering questions in the chat. So let's get going. Susan, I'm going to pass it over to you. Let's just kind of give an overview. Give us the landscape of integrative health and wellness coaching.
You bet. Thank you, Nicole. I'm really glad to be here today and excited to share a little bit more about this program. This has just been just a really exciting place for me to be for the last few years as we've gotten this program going. I began my career as a physician assistant over 10 years ago, and I was in primary care for a long time. And what happened is that I was starting to treat so many things that were really related to someone's lifestyle. I'd be giving medications to people and I'd be saying, oh, what would be really great is if you could lose some weight, decrease your stress, exercise a little bit more. All right, I'll see you in 3 months. Good luck with that. See ya. And they'd go on their way and they'd come back and they weren't really making any changes. And behavior change is not easy. It's not hard. I mean, it's not easy. It is hard. So looking at this article, actually, the numbers are really shocking to me. The amount of people, the amount of deaths that are related to lifestyle diseases. I mean, there's a lot that goes on with genetics and other parts that play a large part, but really there's a lot of things that have to do with our lifestyle and how we live from day to day. So really what I went back to health coaching because I really wanted to help people make those behavior changes. Actually, when I signed up for a health coaching program, I thought that I was going to be learning diets and nutrition, exercise programs, all of these different things. And when I came into the Duke coaching program back in 2011, I realized that it was something completely different. I learned how to listen to someone. I learned how to take off my expert role hat and actually help someone make a behavior change. Because behavior change is so much more than me telling someone what to do. And as Eileen can probably attest as a dietitian, one of the hardest things I think to do coming into the health coaching role was to take off that expert hat. I no longer had to say, this is what's wrong, this is how you're supposed to fix it. You think about the number of times you've told someone what to do and if they actually do it. Whereas when I sat down and listened to someone and said, well, what do you really want to do? How do you want to make a change in your life? We flip this formula. Instead of starting with what they're going to do, as a health coach, we sit down and say, why is it important for you to make a change? What's really important about this for you? So we help them find their motivation and their desire and their why. The next step in that health coaching process is to help them find their how. How are they going to get that done? Okay, so you want to lose 20 pounds. Well, that's really an outcome that you're looking for, but you can't just turn around and say, all right, I'm going to lose 20 pounds. We have to think of those behaviors. So we start to think, how are you going to do that? So we help them discover what are all the little pieces that they think are going to help them make that, get to that outcome. And then we help them get down to the what as well. What is that first little step that they're going to do? So we reverse all of that. We end with the solution, which usually comes from the person that we're working with, not from us. The number of times I've worked with clients and I think I know exactly what they need to do, and they come up with a solution that is so creative and so personal and so what they need to do, and then they actually do it. That is what's really exciting to me about health coaching. Um, what really makes UVM, I think, unique in our health coaching program is our focus on integrative health as well. So built into our curriculum, we have information and sessions about everything from music therapy to culinary medicine to mindfulness, all of these different pieces. Not because you're going to be an expert in there, but really because we want people to become aware of all the different things that help someone stay healthy. One of our tools that we use is this wheel of health right here. The wheel of health is something that helps someone take a reflection of an idea of what's going on in their own life right now. Everything, as you'll notice, nutrition and exercise are a part of this wheel, but also we think about our environment. If you look around your space right now, how do you feel? How does it make you feel when you look around? Is it cluttered? Is it making you more stressed? How do you feel when you're being surrounded by warm colors, pleasing scents, all of these different things? Those impact our health and wellness as well. Our relationships, all of these different things. So when we sit down with the client, we just don't say, what are you eating? How much are you exercising? There's all these other pieces that come as a part of that. And so that all impact our health and well-being. So that's really a quick overview about what health and wellness coaching is.
Thank you so much, Susan. And I want to dive deeper into that in a few minutes, but I want to toss over to Eileen because very similar example to Susan in a career in medicine and health, but there's something missing because you added this. What drew you to integrative health and wellness coaching?
Yeah, that's a great question. So I actually was meeting with a health coach at the hospital where I work, and he was doing biometric screening. And as he was checking my cholesterol and he was asking me questions about my diet and exercise habits, I was picking his brain about what his role was as a health coach working for the community health team. And after that, I went online and I was so excited to see that UVM was just in the process of rolling out their Integrative Health and Wellness Coaching Certificate program. So I reached out to Dr. Westervelt and she answered all of my questions and I signed right up, and I was so excited, and truthfully, it's like the best career decision that I have made thus far. But I really didn't know what integrative health was at the time. So when I saw the Wheel of Health, which I know you just saw a slide depicting that, I was like, wow, that really makes sense to me. So I was drawn to the field of health coaching because I feel like it really complements my career as a dietitian as very well. And the Wheel of Health, I just love the holistic approach of that, and the very structured process of health coaching really helps clients to look beyond the diet and the foods that maybe they want to stop eating or eating more of, and look at other areas of of their health and wellness that maybe they haven't really thought about or considered, and explore the relationships between these other areas on the wheel of health and how they affect their nutritional habits as well as other aspects of their health and wellness.
Thank you for sharing how and there you are
yeah.
too. So I wanted to jump over to this picture and this quote from you, because I think this is an interesting point as well, that, and I'll ask our participants, and if you feel comfortable putting in the chat box, are you coming back to learning to a classroom after being away for a long time? And I think that your quote here that you to say that you were nervous about coming back. And so what was that experience like for you to come back into a classroom, and how did you kind of get into the rhythm of being a student again?
Right. So yes, I was very nervous. It's been a long long time since I've been in the classroom setting. My joke is that years ago when I was in the classroom, blackboards were on the wall, not on the computer. But from the moment that I reached out with questions about the Integrative Health and Wellness Coaching Certificate Program, I felt like my questions were answered, and it was nice that there were several other non-traditional students in my class as well. But I can't say enough wonderful things about the instructors. They are very, very accommodating. They are very concerned and motivated to help everybody do their best. I certainly felt very prepared for the certification exam that I took in February, and all of the instructors are just wonderful. And I can't say enough good things about them.
Eileen, how did you get back into the groove? How did you get back into with working full time and going to school again? How did you reacclimate and get back into the groove?
I'm sorry, I missed part of your question, I think. How did I get back into the groove of being in school?
Yeah.
Okay. Yeah, that was really tricky. And truthfully, that was one of the things that I was most concerned about, because I have a full-time job. Actually, I have 3 different jobs, because I work as a dietitian at the hospital, and then I have 2 consulting jobs at area nursing homes. So I already had a lot on my plate, and I wasn't really sure how I would fit this in. But I knew that I wanted to do it, and I knew that I really wanted to make time for it. And most of the classes, actually all of the classes that I have taken so far, have been evening classes, which is great. So I think that's probably intentional as a way of being able to accommodate schedules for people who do work. So that's been really helpful. And then this past semester, all of my classes were online. So that was nice. And then, and actually last year too, we went online in the middle of March, as everyone knows. So I just, I made it a priority for myself. I felt like it was an important thing for me to do. And as I say, it's been one of the best decisions I've made.
It's interesting too, just to hear how Susan was talking about behavior change, and change is difficult. And, you not only embarked on learning, but you were also changing your own life to accomplish something, and you made that a priority. And I think that's an interesting point that we hear a lot in terms of behavior change. Why is it important to you, as Susan was referencing before? Eileen, we'll come back to you in a few minutes, because I want to get more on your perspective. And please, as I mentioned, if you have any questions throughout the presentation, do put those in the chat box. And Susan Jefferson, thank you for sharing with us that it's been a long time since you've been in a classroom, virtual or in person. So we're hoping that we get to see you in our program as well. So Susan, why don't you take us back through more logistics of the program itself?
Yes, let's talk about what this actually looks like. We have a integrative health and wellness coaching certificate, and we also have an ability for you to just take the classes required to sit for the national board exam. So there's two different tracks that you can really think about as you're going through here. So the first 8 credits that you would need to take, these 8 credits would allow you to sit for the national board exam. In order to get a certificate from the University of Vermont in integrative health and wellness coaching, there's a total of 15 credits that you would need in order to get that certificate. So how this starts is our first semester. Our first semester, you take 4 credits of classes. We have an immersion weekend that happens in person here at the university. During that immersion weekend, we're doing all sorts of integrative therapies together. We're learning and building our learning community together. Because we're going to spend the next year together. And it's really in a small class. We have up to 30 students that are in there. So you get to know everyone in that class. Even though it's mostly virtual, you do spend a lot of time getting to know and sharing personal stories with each other. So we have this immersion weekend, usually happens within the first 2 weeks of the semester, depending upon holidays, Memorial Day or Labor Day, all those different pieces. So we start with an in-person immersion weekend. If you're not able to make it up to Vermont, we do have accommodations in order to make that happen for you. But it is beautiful in September. The leaves are starting almost to turn. It's a really nice time of year to be here. You start the first 5 weeks with motivational interviewing. And after that, we move into 9 to 10 weeks of our skills lab. These classes are all done over Zoom. They usually take place the first semester on Monday nights from 4 to 7 at night. So it's something that you can move into. Second semester is very similar. We start with some motivational interviewing and also have some health coaching skills labs. Again, these are on Wednesday night from 4 to 7 in our second semester. We end with an in-person immersion weekend. So this is where you will sit for our exam, which is a simulated patient experience. So we have a sim lab that we share with the medical school. We're able to go into that sim lab, you see simulated patients, and do a coaching session with them. By the time you get to that point, you will have practiced so many times and with so many people, you hopefully will feel completely comfortable there. So that ends our experience at that immersion weekend. After those 8 credits, you are eligible to sit for the National Board Certification exam. At that point, you can start collecting your 50 coaching sessions that you need in order to apply for the National Board exam. And what's really unique about Vermont is that we don't stop right here. We support and continue to support our students throughout that. What's really great about taking that certificate is that you can take some extra electives. One of the electives that most of our students take is building your coaching career. In this class, you bring in recordings from your sessions that you're having out in the community. You get additional mentoring. There's a built-in study guide for the national board exam. We bring in various speakers from all around the community to talk about how they're using health coaching in their life. So that's a great class to help continue and get you ready to sit for the national board exam. We had 94% pass rate on our first group of students that went to the national board exam, which we were really excited to see how well this program supported them to sit for the national board. We have lots of different electives as well. If you want to focus on family wellness, we have a class about that. Autism spectrum. There are lots of other classes that you could take. One other great class we have is this advanced mentorship class where you can learn and support the cohorts behind you. So you can actually give them feedback, and all the students that I think have gone through it have been so grateful for the chance to not only practice this, but then teach it to somebody else and really help solidify and learn as you grow. So lots of different options for electives that we have there. Our program really is focused on an interactive experience. Our students become clients with each other. They experience hands-on really what it's like to go through this process, and they hone their own practices. We start each class with some sort of centering exercise, so you're exposed to a lot of different pieces there. And our students really do develop a pretty strong bond with their classmates. They experience a lot together. I know Eileen's group went and moved through the whole COVID transition together, and the amount of support amongst the people in the group was really impressive, as they were just helping each other figure out how to hit Zoom and record and all of these things together. So I really enjoy helping that community grow each semester. One of the other really exciting parts that we have is the continued support that we have. Kara Feldman Hunt created an integrative practitioner network for any integrative practitioner in the state of Vermont. Our students are allowed to go on there to post a profile as a trainee. You're offering free health coaching at this point, but we advertise this to primary care offices, to employee wellness, to our student body, and it helps the students. I know as I went through the program 10 years ago, finding clients was one of the hardest things, and we really work hard to try to help our students find clients as well. And through that practitioner network, we did a quick survey, and people were finding it helpful. Even as a trainee going through this program, people who were going through and listening to this and working with a health coach were finding that their health and well-being improved. And we're really likely to recommend it to other folks. So it's a fun program. We've created the Vermont Coaching Collaborative. We meet monthly with all certified health coaches in the state of Vermont. We're trying to advance health coaching. We're trying to come up with pilot programs. We're working with the new CPT codes. It's a really active and engaged community that we're trying to create, even after you're done with the program. So even if you don't live in the state of Vermont, though, there's something that you can take from that, and you'll always be a part of our community.
We have a couple of questions, so I want to pause just for a second before we get into where health coaches work. Pamela asked, is this certificate program best ideal for people who already work or have a degree background in healthcare? Because we definitely see a lot of examples of students coming from a background in healthcare. Or does the certificate program also work well for those who simply have an interest in health and wellness? What do you think, Susan?
That is a great question. And one of the other really unique parts of our program is we have undergraduate students as a part of our program as well. So there are continuing ed and undergraduate students. These undergraduate students might be majoring in a field of health and wellness, but they don't have their degree yet. And what I have found actually really interesting, Eileen might be able to touch on this as well, that almost if you don't have a degree where you are an expert in a field, it's almost easier to learn the skills than it is to unlearn the skills as a healthcare provider and learn the health coaching skills there.
Good point. Absolutely good point. And right. Good point. Erin asks, is there a way to get a copy of the slides? Yes, we will share those out with the recording. And I did forget to mention in the beginning, we are recording this presentation. And so we will share the recording and the slides will be included in that. So I wanted to also get to Susan's question, Susan. If I already have a bachelor's degree and a degree in culinary, do these credits add to another degree, like a master's in nutrition? Being able to create a new career is what I'm looking to do. I live in Vermont. Maybe a little clarity, Susan Jefferson, on what you're asking is, do these credits in integrative health and wellness potentially move towards a master's degree? I think I'm trying to understand that right. Yes. Okay, great. Our Susan Whitman, any thoughts on that?
I'm not 100% sure on that. I think some credits might be able to be transferred towards a degree. I don't know if Kristen knows any information on that one as well. Our certificate is a standalone certificate. It's not a part of any master's program or any other piece on there.
Or would you really need to do that in terms of go get a master's? Well, let's weave this into what I think is the slides that we're seeing now too. You know, what are the opportunities out there for health and wellness coaches with the certificate and sitting for the National Board of Health? What can you do? Where do people go?
It's a great question. As a certified national board health and wellness coach, you can hang your own shingle. You can start your own health coaching business. That's how I started as well. You can work, actually, I've probably done all of these. I worked with a doctor's office. I was a part of a community health team here in Vermont as a health coach. I also worked for a national firm for a little bit, a national firm that offered health and wellness coaching. So I was doing telephone coaching nationally. Health and wellness coaches are, some of our grads have been hired into fitness centers, into employee wellness settings, lots of different places that you can be as a strict health coach. That being said, a lot of people like to combine it with a degree that they already have. We say as a health and wellness coach that we don't give advice. We don't offer nutrition plans. We can't offer any of that in our scope of practice. But if you have an RD degree, such as Eileen, or you have some type of other degree, you can use your skills as a health coach to really further your career and become an even more effective dietitian or exercise therapist or physical therapist. Really bringing in, it's a lot about communication and motivation. Motivational interviewing is really at the heart of this. So it can complement almost any degree that's out there.
For sharing that. Eileen, I want to come back to you because I really want to dive a little bit deeper into this point as to how this has complemented your work as a dietitian and some of the other consulting work that you do with a nursing home. How has it changed the work that you're doing?
Yeah, so yes, I am working as a dietitian. I work in dialysis, which is a population of clients who often have a lot of other health issues, diabetes, hypertension, hyperlipidemia. And then I work in a couple of area nursing homes doing consulting work with a geriatric population. And I would have to say that, as Susan said, the skills that I learned in motivational interviewing have helped me a lot. Just asking more open-ended questions, affirming what clients are saying, and then reflecting back what they're saying to them are really some of the core concepts of motivational interviewing. And I use those skills a lot. And I have really pulled some of the pieces of the Wheel of Health into my conversations with clients too. I always knew that there were a number of factors that affected how people eat and their nutritional health in general, but I never really felt like I had the skills that I do now with health coaching to figure out how to incorporate that in my conversations with clients. So I certainly do that a lot more. I think empathy goes a very long way in helping clients to see that you can understand where they're coming from, and it really helps to establish a great rapport. And then just active listening. I spend a lot more time listening than I ever used to, and I'm listening differently too. I'm listening with the intention to understand rather than thinking about what I'm going to say next. So I think my dream position as a dietitian and a health coach would be to continue to work in a healthcare setting, but I would love to work in a setting that offers more of a multidisciplinary approach with other providers who can work to help support clients in making some of these behavioral goals and changes.
Great. Thank you for that perspective. It sounds like you've taken so much out of the program into your work. So that's really wonderful to hear. I just want to come back to Marky's question. Is there a way that we could watch a motivational interview? That's a great question. Maybe we could start weaving those into our info sessions as well, Susan. But where could someone see an example of this kind of thing that's used in our program?
A great question. And I'm not sure. I've done a lot of looking around to find places where I could show show examples, and I've created my own series of examples. I don't have those posted anywhere, but that is something that we probably should consider.
Great. Yeah, we'll follow up on that. I love that idea. So I just want to be mindful it's 12:30 and I'm sure everybody has plenty to do today. So I just want to come back to, okay, so if you're interested, how do you do this? And I also just wanted to share that our fall semester is about to go on to a wait list for our integrative health and wellness coaching. There's so much interest, which is amazing, for health and wellness coaching. So I just wanted to share that please do get your name on our wait list if you're interested in the fall, but we're also then working with prospective students to look at the spring semester, and Kristen can share any more information about that or any questions that you may have. And I just wanted to make note that the slide that Susan was sharing a few minutes ago, I'll just zip back real quick, looking at the semesters and the flow of the courses applies and will kick in the spring semester as well. So yes, and Susan Jefferson's asking to get on that wait list. Kristen will follow up with you as well. So let's just round out with, what does this look like? How do you get involved, Susan?
Well, if you are interested, there is a link that Kristen just put in the application. If you have more questions, you definitely can get in touch with an advisor at the Continuing Distance Education department. There's a short online application that you can fill out, and once you hear from that, you're able to get started.
And as Kristen just put in that link, so Susan or anybody interested, we do recommend, getting on that wait list, getting your application in, answering any questions. Kristen would be happy to talk with you as well, and we will share out the recording from this presentation. Just want to give a shout out if anyone has any additional questions. And while I'm just asking one final question to Eileen, maybe share with the students that are thinking about this program, our prospective students that are in this webinar with us, why should they do it? What is the selling point? What's the last bit of advice, Eileen, that you would offer to people considering going into this career?
Yeah, that's a great question. I initially went into the career thinking that I was doing this so I could figure out a way to help my clients and to serve them better. And I certainly learned a lot of ways to do that, but I also learned a lot about integrative health and some things that really have resonated with me. And mindfulness is probably the thing that I have connected with the most in my classes that I've taken thus far. And this past semester, I decided to take a class. As Susan mentioned, you can take some electives, and you need 2 electives in order to achieve those 15 credits. So last semester, I took an elective called Mindful Eating, and this fall, I'm finishing up my 15 credits with a mindfulness class where I'm going to be learning the mindfulness-based stress reduction program as well. So I'm very excited about that. And again, I was surprised that that there's a lot in this program that you learn for your own health too. So that was wonderful.
Great. Thank you. Thank you, Eileen, for joining us in our studio today and sharing your perspective. Again, congratulations on passing the exam. We wish you continued success. And Susan, thank you so much for sharing your expertise and guiding everyone through the logistics of our Integrative Health and Wellness Coaching Program. We wish everyone a wonderful afternoon. Take care. Bye-bye.